Bolbilaka. After another 2,065 tests, we have confirmed 4 new cases of COVID-19 since yesterday. 2 are border quarantine cases. These are both soldiers returning from their tours of duty in Sinai. Dr. Alicia will cover the details of these 2 cases in a moment. The other 2 cases are local. One is extremely serious, and I want to talk through exactly how this case came about. The patient case 125 is a 53-year-old gentleman admitted into Lota Hospital on the 19th of April, 2021 for a surgical procedure. The procedure was performed successfully. However, on the 28th of April, he developed some respiratory symptoms. On the 29th of April, he was seen by case 120, the 25-year-old doctor. He was asked to be swabbed for COVID-19. However, he refused on 2 occasions. The doctor developed symptoms on May the 1st and then tested positive yesterday. On the 2nd of May, the same patient was assessed by case 121, the 30-year-old doctor. We know that this doctor, case 121, had tested negative for the virus on April 26th. He tested positive yesterday as part of the contact tracing for case 120. And his results indicate that he recently caught the virus. Early today, the patient's condition began deteriorating. He was moved into intensive care unit and swabbed for the virus. Barely 4 hours ago, he tested positive for COVID-19. His condition will be discussed more with his family before any public announcement can be made. His described timeline and recent deterioration in his condition indicate that he is likely a late-stage carrier of the virus. So we suspect that this patient, who is case 125, transmitted the virus to the doctors and not the other way around. We do not know when or where this patient contracted the virus. It could have been from outside or within the hospital. Our response must consider both possibilities. From a statistical standpoint, ICU cases, like the one we now have, may be a red flag for widespread transmission. Essentially, it tells us that there are likely many more cases of the virus out there. We have dreaded a worst case scenario such as this since the day of our first case in March of the last year. Through that time, we have gone through great lengths to prepare for it. Those months of planning have informed an immediate whole-of-government course of action. Our first priority is to contain the cases we know about within Lota Hospital. To prevent the hospital from becoming ground zero for a wider outbreak, the members of our discipline forces have locked down Lota Hospital in a matter of hours. It is now a tightly contained, full-time COVID care facility. More than 400 doctors, patients, nurses, and other staff have been sequestered and will be effectively quarantined within the hospital until we can determine who else may or may not have had contact with this patient. Some staff who had left the hospital have been called back in. RFMF personnel and members of the police have ring-fenced the entire hospital and will strictly manage who is allowed into the premises. Lota Hospital will be closed to the public. All medical services will be rerouted to a network of backup hospitals in Nandi, Ba, and Singatoka, as well as the Punjas and the Kamikamida health centers in Lotoka. We've activated the entire government machinery to ensure that these critical services remain accessible to our people. As we've announced before, the borders of the containment areas are open to those traveling for medical emergencies, so this can already be facilitated. Given that we expect more cases and more severe cases, sections within the Lota Hospital have been converted into intensive care units, which will house additional beds and ventilators. The staff of Lota Hospital will be accommodated and work within the hospital while contact tracing continues. Remember, our staffing capacity was already stretched due to the quarantine of close contacts of our 2 doctors. Those who are working will operate on high alert, fully equipped in the proper personal protective equipment. They will be screened regularly and tested often. We are going to provide them with any and all support that they need. Food, supplies, bedding, whatever they require. We will provide. Finally, not only in the hospital, but around Lotoka, there is going to be a lot of swabbing. The protocols of COVID management across the healthcare network are being strengthened further, so that these facilities can continue offering their normal services to bear the outpatient load from Lotoka. Our other local case is a 27-year-old who resides in Narere. She entered quarantine on the 28th of April 2021 as a contact of one of the cases from Makoi. Further investigations reveal that during a family gathering on the 17th of April, she also came in contact with another case from Makoi. She was confirmed positive for COVID-19 this morning. The gathering is now potentially the source point of 3 cases. It was only a small family gathering with members from a few different households, but that was enough to have national ramifications. It is why one of our first and most important health measures, which we introduced, was to limit gatherings of all sizes everywhere in Fiji. The members of this patient's household have also been in quarantine from the 29th of April. All have tested negative for COVID-19 at this time. Contact tracing is ongoing into her movements before being quarantined. Unfortunately, she did not have a Care Fiji app installed, so we are relying entirely on our traditional contact tracing methods. If she had a Care Fiji app and had kept it on, this could happen much faster. With more than 250,000 downloads, Care Fiji is rapidly being widely adopted across the country. Thank you to everyone who has taken this simple life-saving step. But on behalf of our contact tracers, I won't speak quite about the need for more downloads of the app until the number surpasses 600,000, which is the number of smartphones in Fiji. We have received the genomic sequencing result from the microbiological diagnostic unit at the Peter Doherty Institute in Melbourne with regards to the first COVID-19 case of unknown origin in Ra. We confirm that the virus this patient has is genetically identical to other local cases, and it is the same B1617 variant that was first detected in India. So while we have not established a direct person-to-person link to other local cases, we know that this case is linked to the others. And it is within the same cluster that links back to the border quarantine facility. While this genetic link is a positive news, it is not. We have not yet established person-to-person link, and therefore there is possibility of other chains of transmission that are still happening in the community. There are likely more cases out there linked to this cluster that we have not yet found. We still have 3 cases of unknown origin in Fiji. Case 116, the second gentleman from Ra, whose sample is being genetically sequenced in Melbourne. Case 120, the 25-year-old doctor in Lota Hospital. And this most recent patient at Lota Hospital. Though, as I mentioned, we suspect the doctor contracted the virus from this patient. In light of the severity of the situation in Lota Hospital, the ministry's recommendation is to maintain the current borders of existing containment areas. fuel, food, freight, and medical evacuations are moving across these containment area borders. Fiji, I do not use the word war lightly, but right now, we are in a war with the virus. And the front line has just extended to Lota Hospital. This will be the greatest test of our healthcare system. It will be a test for all of us. Lives are at stake. Sacrifices must be made. And every Fijian's commitment is needed. This virus is insidious. It is unrelenting. All it takes is one unknown case in our community to spark an explosion of cases across the country. If that COVID-positive person remains unidentified, they are at risk, and so is the nation. But if that person comes forward, we can care for them, we can keep them safe, and we can keep the country safe. Every day of an early diagnosis adds effectiveness to the treatment we can offer and stops the spread of the virus before it rages beyond our control. I know our hearts are breaking for this patient and his family. And we all have a great deal of empathy for our healthcare staff who are now working and living within Lota Hospital. My teams will go to every imaginable length to prevent this virus from spreading further. As our Honorable Prime Minister has said, our frontliners deserve more than your empathy. They deserve more than your gratitude. They deserve your respect for the science that informs their every action. Your adherence to our health measures is the highest form of appreciation you can show. Let's all show it together. Thank you.
Thank you. So as the Permanent Secretary has just announced, we have 4 new cases to report. The first 2 cases have already been discussed by the PS, so I'll go on straight to the next 2. So the next 2 cases are border quarantine cases. These are a 33-year-old and a 46-year-old male who arrived in Fiji on April the 27th and are soldiers returning from international peacekeeping duties. They tested positive during routine testing while undergoing 14 days of quarantine in a government-designated quarantine facility in Nadi. Also, 9 more patients have recovered from COVID-19. So now there are 39 active cases in isolation. 8 are border quarantine cases, 28 are locally transmitted cases, and 3 are currently under investigation to determine their source of transmission. The 3 cases under investigation, as described by the Permanent Secretary, are the second male from Ra, case 116, the 25-year-old doctor at Lota Hospital, case 120, and the most recent patient at Lota Hospital, case 125. At this stage, we suspect that the doctor contracted the virus from this patient. So in total, Fiji has had 125 cases since our first case was detected on March the 19th of 2020. And we've had 84 recoveries and 2 deaths during this time. A total of 58,321 COVID-19 lab tests have been conducted, and our daily average of testing is now 1,281 tests per day, and our weekly average is 5,995 tests per week. Yesterday, we conducted 2,065 tests. Our overall test positivity is 0.2%, and our 7-day daily average test positivity is now also 0.2%. Thank you.
Thank you, PS and Dr. Alicia. Bulavanaka, ladies and gentlemen, and members of the public who are watching in this evening. So as you have heard, Lota Hospital, delivery of services have been affected by this new case. Nonetheless, alternative sites for emergency services have been put in place and are now activated. The FEMAT team have also been activated, and they'll be moving in tonight to support the services at Lota Hospital. So we have 3 health facilities that have been activated and will be operational 24/7 starting tonight. Kamikamida Health Center, Punjas Health Center, and VCC Health Center. So for the people of Lautoka, if you are sick tonight and need to see a medical doctor or a nurse, you can present to Kamikamida Hospital or Punjas Hospital, whichever is closer to you, to get the medical attention that you seek. Expect to be swabbed for COVID-19 as part of the investigation protocol, so we are asking that you please cooperate. For pregnant mothers, we have set up the VCC Health Center for your care tonight. People of Lautoka will be very familiar with where VCC Health Center is. Just in case you don't know where it is, if you head towards VCC village from the Lautoka city end, as you go down the hill and about 10 to 15 meters from the village, the health center is on your left, just before the village. That's where the VCC health center is. So for those of you at home, pregnant mothers at home, and you starting to have pain or symptoms that you feel a doctor or nurse must see or attend to, that is the place for you to go tonight. For the rest of Fiji, our response effort continues. We have 58 stationary screening clinics that have been operating, and in the last 24 hours, some 4,598 Fijians were screened and 626 swabbed. It gives us a cumulative total of 34,926 individuals who have been screened, 6,262 swabbed. Our mobile community screening continues throughout the country in the Western Division, Central Division, as well as in Tabiuni in the Northern Division. In the last 24 hours, we screened some 21,398 individuals and swabbed 1,212 individuals, giving us a cumulative total of 243,548 Fijians who have been screened to date, with 7,278 individuals swabbed. Our targeted mass screening also continues, and we are very happy with the coverage. There, 100% in areas that we've targeted, or near 100% in the Central and the Western Division, and also our follow-up of our quarantine facility discharges is now at 98%. We have the 13 community isolation facilities that remain open and currently occupied by positive cases and looked after by our Ministry of Health team, as well as supported by the RFMF team in the facilities. Our quarantine facilities, as stated yesterday, continues, and as you heard, as we've discharged cases from the hospital, positive cases, we are also discharging their contacts who were kept at the quarantine facilities in Nandi. We also anticipate to have some discharges tomorrow of the 300 plus repats that are currently staying in the quarantine facility. Just to conclude, we reiterate our message, key messages, as has been stated by PS, and we are restating it again. The COVID safe measures should be habits. Wash your hands regularly, social distance, wear a mask, and practice correct cough and sneeze etiquette. Stay home if you don't have to access essential services. And as you know, the virus moves when people move. Download the Care Fiji app now and activate it. Get vaccinated when the opportunity arises. And in these trying times, be kind. Be kind. The virus is the enemy, not the person. Thank you very much.
Thank you very much, Dr. Kudrabu. Thank you, Fong and Dr. Misha. Members of the media will now open for questions. Please stay forward with your name and organization.
Thank you, Dr. Alicia Semi Turanga from Fiji Village. The 53-year-old patient who had surgery and was seen by the Lota Hospital doctor who tested positive, you are saying you suspect that the doctor got it from the 53-year-old patient. Is that the only link you've established so far with how the doctor may have contracted the virus in your investigation for source of transmission, or are there other links you may be tracing?
So as we mentioned before, we're still quite early in the investigation. So the doctors tested positive yesterday, and then this patient tested positive today. So when we're doing our contact tracing, we investigate a number of different possibilities. One of the possibilities was possibly it came out from the isolation ward somehow, even though we know that none of these doctors worked in that ward. We still were testing all of the isolation ward staff. So we've tested almost half of the staff now, and so far they've tested negative. We're waiting for more test results from that. We also see if any of their close contacts tested positive for the virus. So we've tested almost all of their close contacts now. None of them did, except for this second doctor, these two are close contacts. And then the other thing we start doing is testing all the patients around them. And in doing that, that's how we found this patient. And we could establish that both doctors did have contact with the patients. And as the PS described, the timeline of when this patient started developing symptoms. So this patient developed symptoms first, and then the 25-year-old doctor had contact with the patient. 2 days later, she developed symptoms. Then the other doctor had contact with the patient the next day, and he did not develop symptoms, but we know that on the 26th of April, he had tested negative for the virus. And now his recent test results from yesterday and today have shown that this second doctor is very early in infection. The viral load is starting to go up now. So what we can see from this track, that these doctors got this infection recently. This patient had symptoms before, and then the doctors got symptoms. So just based on this information that we have, this is what it's pointing us towards.
Can I just, because it's still on Lota Hospital, more than 400 doctors, nurses, and patients have been contained. Are you able to say what's the split there between staff who will actually work to continue to manage the Lota Hospital and the ICU that will be operational, ICU centers, and those that would actually be part of the greater isolation in the hospital itself?
So the COVID ward still remains active. The staff that will work in the COVID ward, they stay in and around that ward. They don't go out of anywhere. Okay, good. What the rest of the staff will do is they will work on shift work to care for the extra 100 or so patients that are in Right now, I guess the one thing that's in our advantage is the fact that Lota Hospital was only 30% bed occupancy. There's only about 100 people in Lota Hospital. So we do what we want to do is have enough staff to look after that 100 and do alternate shift. But we also need staff to do cooking. We also need staff to look after the gas pipes. We need staff to look after the various other machinery, including the laboratory. And we also need maids and other stuff like that to actually keep the hospital running for the rest. At the same time also, we also want to expand. There is another area that we have opened up for us to take in any more persons who get more sick with COVID, severe COVID. Because if you do have a severe COVID case, and we prove a severe COVID case, that's the best place to manage it at this point in time, for obvious reasons. So yes, the 400 is a huge split of staff, but it also includes the staff that will manage each and every person. Yes.
Good evening, sir. I'm Areta Voxukongo from the Fiji Times. Fiji now has the variant that was found in India. My question is, why has our situation not worsened similar to the one in India? Are we doing something different?
Yes, what we are doing, and probably I'll get Dr. Alicia to explain a little bit more after this. For every person that we find as a case, our contact tracing is hugely extensive. And what we are also doing is that we're locking down areas quickly so that people stop moving, so that we can find all the contacts. From the data that Dr. Tundravu just explained, we are in most of our contact tracing coverage is way more than 98%. Most of it is 100%. It just takes a couple of days for us to get up to 100%. Okay, so every time we find a case, we are jumping onto it very quickly. The same reaction will happen with this sick gentleman. We will have to look back as to where he could have acquired it. If we feel that he might have acquired it in the community, we will screen. But see, the important thing is, for the rest of Fiji, we need people to front up with symptoms and get themselves swabbed in any of our facility that we have as a screening clinic. We are also going to send mobile teams around to keep sweeping back and forth, especially within Lotoka. We'll have to get teams sweeping back and forth to keep on looking for any more extra cases that they may find. That is this is hard work, but this is the work that has to be done.
I think the comparison to India, we're in a very different situation from India, and we have been for over a year now. The biggest difference, I think, was we have started from zero. We went a whole year without any evidence of cases in the community, where countries like India, including India, always had cases. From when they first started getting cases, they always had cases. It would lull, the case numbers would lull, it would pop up again, it'll go down again. And then we have this variant, which seems to be more transmissible, and there's also other variants, including the UK variant that is in India. So they never had zero once they started getting cases in those countries. We did start from zero. We went a whole year without any evidence of cases in the community. So yes, it is still early days. We have done a lot to try and contain this virus. As you've heard all of the thousands and thousands of screenings and testing that have been done. We found cases that have been linked to each other. But we're also very concerned as medical professionals because the information that Dr. Fong just shared with you today, for example, about the Ra case. So we know that he is linked back to the cluster that goes all the way to the border quarantine facility. It's the same virus. Genetically, it's an identical virus. but we can't link him in terms of person to person. We don't know who he got it from exactly. And that's important because that means there are other people in between him and that point. There may be other people beyond him that we haven't found. So that's a worry. And we keep doing this testing in the community as well, just in case there are cases that pop up that have no links. And so this case that just come up in Lota Hospital is one such case. That is why we're doing so much testing. That is why we're doing so much screening, because we want to find these cases now. And as we've said so many times, right now is absolutely the most critical time. This is the time when we can have control over it. You know, a month down the line, 2 months down the line, that what happens then will really be an indication of how successful our measures are that we are putting in right now. So that's why we really plead with you in the community. Please do your part. Thank you.
Alina Reese from FBC. I understand that the critical patient is currently admitted at the Lota Hospital. I wanted to ask whether you know where he's from and and whether your teams have established his movements as of yet.
I think at this point in time, we are focused more on containing the problem. We will get that information in due course, and we will respond to that information in due course. But for us, just for tonight, for the purposes of tonight, and our response and the actions that we are doing tonight, that's not a piece of information that we are particularly interested in. It is of interest in the ongoing response. Definitely, when we're going to do the contact tracing and all that, we will begin to pull that out. But you have to remember, as I mentioned, he was just positive 4 hours ago. This is one of the reasons why we were a bit late today, because we knew we had to give you as much up-to-date information as we could, but not up to this extent. Sorry. Just another thing, just to add on to what Alicia has mentioned. I hope we all understand, and I hope the people of Fiji understand, why we need the Care Fiji app uploaded on your phone. It is so much easier to find contacts on a Care Fiji app than it is to get somebody to remember where they went to. Right now, it is so difficult asking people, where did you go to? In the shock of their diagnosis, the last thing they want to remember is where they went to. It takes a long while when they settle down and then they start telling us where they went to, what they did. So this is why we need the Care Fiji app uploaded. And when we get the vaccine around, we need people vaccinated.
Dr. Fong Merioni from Fijian. I understand the critical patient refused to get swabbed. What happens then when a suspected case refused to get swabbed?
As is true for every doctor, when you're dealing with an invasive procedure and the patient is conscious and can make their own decision, we must get a consent. You never do anything without a consent. If they are unconscious or cannot make that decision, then many times we may assume the responsibility of the patient. If the patient is conscious and we want them to take something that we cannot, that we basically need him to do, but he refuses, the only way we can do that is through a court order. Moving forward, maybe we will explore some other legislative framework to help us in this difficult time so that we can make sure that people who need to be swabbed get swabbed. But again, that's not an issue for our discussion tonight. It will be something that we discuss later.
Thank you very much, Dr. Fong, and thank you very much, Alicia. The members of the media that are well for coming in tonight, but also concludes our press conference, and we hope to